Hi, I'm Dr. Lairmore at the Hutchinson Clinic Orthopedic Department, which if you're watching this film you'll already know because I just did your knee and your hip. There's a number of things that I've been wanting to get on video so that people could reference back after they leave the hospital, or that seems redundant for me to continue to say. I want everybody to understand the things that are very important about getting through a total hip and a total knee, so we're going to go over these in the video. I appreciate your time in watching. It's important for you to have a good result. That's what we want. That's what you want. The first thing I'd like to talk about is what we do post-operatively for pain when you go home. For most patients, unless you're allergic, we're going to put you on 4 medicines. One is an aspirin. That's not for pain. That's for blood clots, and we'll talk about that separately. The other one is an anti-inflammatory called Celebrex. The third is a medicine, it's a nerve medicine called Neurontin. And the fourth is a narcotic pain medicine if you need it. The most important things here are, take your narcotic pain medicine if you really, really need it. Ice is your friend when it comes to pain. But if you need a narcotic, take your narcotic. Realize it has significant side effects. Dysphoria, if you feel funny, you hear things, you see things, stop taking it. Constipation is a big problem with narcotics, so be prepared and don't get behind on that. With respect to the other medicines, we've been having some problems with the pharmacies wanting to refill them at higher doses because it's cheaper. Don't do that. I only want you to take them as directed until they're gone, and that's it. So that's all I really want to talk about there. With respect to pain management, however, you can expect a few things. Your incision's going to be a little pink, it's going to hurt, it's going to swell, and those are normal. You're going to have anything from no bruising to significant bruising. Again, these things are normal. Drainage out of your dressing for more than a week is not normal, and I want to know about that. But your best friend when it comes to pain is ice. So if you have a problem with pain, the first thing to do is lay down, put your leg up or your hip up, and get some ice on it. I want to talk just a little bit about dental procedures, and this is true whether you have a hip or a knee. I'd like you to wait 3 months after your procedure. Make sure that your dentist gives you a prescription of an antibiotic that you take 1 hour before. You only take it one time, nothing afterwards, and you take that anytime you have any dental cleaning, root canals, any dental procedures of any kind, and I recommend that you do that for life. It's just good insurance. Let's talk just a little bit about one of the most important things you need to be aware of, and that's blood clots. Blood clots are extraordinarily rare. We get people up and we walk them, and I want you to keep up with walking, bending your ankles up and down, moving your knees, maintaining your range of motion. Those are probably the most important things. Take your aspirin every single day. Do not miss it. Don't wait. Start taking it as soon as you get home from the hospital. Make sure you wear your white stockings. The compression stockings, I have heard every excuse under the book, under the bus. Probably the biggest one is, oh, I'm only coming to the office today, so I thought I wouldn't wear them. Wear your white socks. I can't get them on. Find a way to get them on. White socks are important. They're one more reason that, or one more modality that we have to reduce DVTs or blood clots, and you need to wear them. Blood clots can be fatal. Take your aspirin, wear your white socks. Don't have any excuses for either one of those two things. We don't want problems. I want to talk just a little bit about range of motion. When it comes to hips, there are 4 precautions that you need to know, and I'm going to demonstrate what those are. The first one is to not bend forward at the waist more than 90 degrees. 90 degrees is like the edge of a book. This is 90 degrees. The worst thing you can do is lunge forward to try to stand up. Put your feet underneath you, put your hands on your thighs, and stand up straight. That's the first one. The second one is we don't want you to cross your operative leg across the midline of your body. You can cross your ankles, but we don't want you to bring your hip way up across like that. That'll increase your risk for a dislocation. The last one that's most important is that when you need to reach to your feet, don't reach back like this outside of your knees. Your hand should be between your knees when you get to your feet. And you can do this 90 degrees here, bend your knee up, and you can get to your foot and not violate any of your hip precautions. So those are the main things I want you to be aware of. But again, the worst one is leaning forward with a lunge to stand up off of a short chair. Don't do that. Probably the most frustrating thing that patients and I have with knee replacements is range of motion exercises. Everybody seems to come in with a different idea about how to do it. Some people wait for their therapist to do it for them, and both of those things can be catastrophic failures. So I want to show you what I want you to do, and I don't care what else you do. I don't care if you walk the dog or go snow skiing, but you need to do this exercise exactly the way I show you. Every time you sit down, you should sit down with your knee feeling like it's under some tension. Don't sit around like this, because that isn't going to help you unless your knee is not straight, and we'll talk about that in a minute. So sit down with your knee bent. That allows your tissues to slowly creep. You're not working at it. It's not hard. Once that is stretched a little bit, then I want you to pull your foot back a little bit more, read a book, watch something scary on TV. It doesn't matter what you do. It can take a long time to do this one time. But do it, and take the time to do it. Once you've gotten back a little bit, creep it back a little bit further. When you can't get back any further, and this is key, start pushing it forward. Pushing it forward, pushing it forward, and pushing it forward. That needs to be done with your rear end down in a low kitchen chair. All these exercises should be done in a kitchen chair. So people ask me all the time about therapy. Therapy is important, but the most important therapy is this one exercise, and I'll tell you why. Your therapist does not go home with you. They're not with you 24 hours a day when you could do this exercise 12, 14 times a day. They're going to see you 3 times a week to make sure you're getting it, but they're not the ones that are going to get it for you. You are. And if you don't do these exercises, you will not get them. One of the biggest misnomers that people have is, I can't go any further. That is not true. In the OR, we have your knee collapse back as far as a human knee will go. It will go there. Yes, it hurts. I get it. I have 2 knees. I've been through this. But if you wait, your knee will scar down. And so when someone comes in and their knee is not bent all the way back, that means that's all the further they've ever bent their knee. And if you do that, your knee will scar down and we'll be going back to the operating room. So at least once or twice an hour, just sit down, let it stretch a little bit, pull it back, pull it back, pull it back, and then shove it forward. So if your knee is not straight, the second exercise to do is to prop your heel on another stool or kitchen chair. Do not attempt to do this in a recliner or your couch. It's very comfortable, but you will not get the kind of stretch you need. Now, if your knee is already straight and you look at it, you're done. You don't need to sit around like that. If your knee is not straight, you should sit around like that all the time until it is straight. And again, one of the most problematic things we have is recliners. People go home, they sit in their recliner, their knees bend a little bit, it's very comfortable, and then all at once they can't get it straight because your body's going to start healing down. So, stretch it if it's not straight. If it's straight, you're done. Check it once an hour. Do your bends every hour, and that's what's going to get you there. Your dressing. Your dressing for both hips and knees is waterproof. We're going to put that on, or the nurse is going to put that on before you leave the hospital. As long as blood is not leaking out of it, it's fine to take a shower. These dressings are designed to absorb a certain amount of fluid and blood, and it'll show up as spots on the dressing, and that is normal. Do not worry about that. Don't change your dressing. Call me. In fact, if you have any problems of any kind, you're worried about something, pop in, call in. We want to know about it. Don't show up at the ER. Don't go to your family practice doctor. They will not be able to help you, particularly if you think you have a real problem like an infection. Now, the exception to that is if you're short of breath. If you are short of breath, go immediately to the emergency room. But if you just have increasing pain and you're worried about an infection, come and see me. There's no rush about it. It could be a day or 2 later. Your TED stockings are for 6 weeks. Your aspirin is for 6 weeks. You're going to see me in 2 weeks, in 8 weeks. We're going to talk about these things again, but make sure at least those are the durations for your aspirin and your TED stocking. For female patients, if you want something a little dressier than the white socks if you're going out, the Women's Center here at the Hutchinson Clinic does offer some designer compression socks, and you might want to check into that. Another question I get regarding hips and knees is, how long do I have to be on my walker? The answer is 5 minutes, but you may need it longer than that. So if you need it for safety, use it. If you feel safer with a cane, safer with a walker, or you feel safer holding on to things, as soon as you feel up to it, your hip and your knee, both partials and totals, are ready to go right out of the OR. So don't have any hesitation to put your full weight on it. Yes, it is going to hurt. Patients always come in and they tell me that their knee hurts, and I already know that. I expect to have significant pain for 2 weeks, night pain for 6 weeks to 8 weeks, off and on pain intermittently for up to 9 months to a year. So I don't need to know that you're hurt. I appreciate that you do. Again, haven't had 2 knees. I know what that feels like. I want to know about important things. Are you short of breath? Are you having chest pains? Are you not getting your exercise done? Are you having problems with a reaction to one of the medicines? Those are the things that are important to me. So when you come and see me, I want to see you in your TED stockings. I want to know that you're taking your aspirin. I want to see that you've got that knee cranked back to 120 degrees in the first couple weeks. Those are the things we need that are important. The pain, the bruising, all of that, while nobody appreciates it or likes it or wants to go through it, is just part of a knee replacement process, and you'll get through it too. So, in summary, this is a challenging thing that you're going to get through just like everybody else does. Life is motion. And for the patients who are able to move again painlessly and get back to their hobbies of gardening and biking and just enjoying walking without pain, you're headed there. So don't be dismayed. Everyone goes through this. I want to say that again. Everyone goes through this. You'll hear lots and lots of stories about how somebody jumped up and ran around after a week, but that's not necessarily true. And you're on your way to being pain-free for the rest of your life in that joint. So work hard at it. Embrace the pain. Embrace the struggle, because it's going to be worth it when you get done.